I think we should move along now. Jim Heubi would come up. As I mentioned, Jim is the medical director of the National Reye Syndrome Foundation and is going to make some remarks.
So I want to tell you, I really have enjoyed having the opportunity to come up today to listen to all the presentations and sort of having the opportunity to be the last person to speak. I think I have some discretion. And that is, I think the Frudenbergers and the Reye Syndrome Foundation over the years have made a huge contribution. Probably they are heavily responsible for the success in us basically being able to have the public health success of getting the message out about the relationship between Reye syndrome and aspirin. You know, even today, we don't even know whether it's truly causative or not. We do know that there is a clear epidemiological link, and I think that information has made a huge, huge difference. The piece that I want to say is I am sort of coming late to this. Karen and I are probably contemporaries. I graduated from medical school in 1973. So when I went to Cincinnati as a pediatric GI fellow, little did I know that I was going into the epicenter of Reye syndrome in the United States, and was heavily counseled and helped with John and Jackie Parton and Bill Schubert, and I will parenthetically say I'm sure Bill brings his greetings, but unfortunately he had an accident a few weeks ago and is just rehabilitating now, so hopefully he'll be back on his, well, he is on his feet, but back better on his feet in the relatively near future. So just to give you an example of what happened to me, and I don't want to go too anecdotal on you, but to tell you, the first weekend I was on call in Cincinnati, we had a girl come in on Friday, and this is probably everybody's dream. My in-laws were in town for the first weekend to visit. And so on Friday evening, we had a teenage girl come into the hospital that had Reye syndrome, and she had grade 4 encephalopathy and really required ventilation very quickly. And we watched her, we exchanged, transfused her. I was there the entire weekend. Sunday morning, she managed to die, unfortunately. And as a consequence, and then very promptly thereafter, we didn't have another case of Reye syndrome, but I had a GI bleeder come in that I had to take care of. So I got a chance to greet my in-laws, say hi to them, and say goodbye. So that was my introduction to Reye syndrome. And my dad was a pediatrician in Indianapolis in private practice. And I have to admit, I'm not sure that I ever saw a case of Reye syndrome before I went to Cincinnati. However, he did relate to me history, and my dad was a great historian because he remembered everything. I don't know how he remembered everything, but in the 50s, he actually described a house where he went to do a house call that he thought that he probably saw a kid with Reye syndrome because it was not a recognized disease at the time. He allowed us how he told me about the mahogany in the wall, the whole 9 yards, and how this kiddo had a sort of a classical history for Reye syndrome. So let me get to the present, and that is, I was absolutely fascinated by Jim Burrell's talk. I have a connection to him because I didn't realize it, because Jim is at Mount Sinai. The chair at Mount Sinai is a guy named Fred Succi that I trained with and has been in Cincinnati. And Jim went and had a conversation with Fred and said he was coming to this conference. And Fred said, "Are you going to the conference?" He said, "Oh, absolutely." And Fred's comment was, "I suspect," this is a quote from Fred, "I suspect they're going to give a prize to someone who finds a case of Reye syndrome." And the other piece I want to say is I really, really enjoyed Karen's talk. It was absolutely fabulous, to the point. I'm fascinated that you can find all these ads from all these years ago. It was absolutely wonderful. Her point on about pharmacogenomics is absolutely correct. It's clear that there are differences in how kids handle drugs. I was fascinated also because I've become very interested in acetaminophen in the recent years, because with the change from use of aspirin to acetaminophen, we now see hepatotoxicity or liver toxicity associated with the acetaminophen, or Tylenol, if you will. It's easier to say Tylenol, but acetaminophen and aspirin have something very much in common. They have a both drugs have a very small therapeutic to toxic ratio. The toxicity of Tylenol is very close, as it is for aspirin, with the therapeutic dosing. And again, if you look at the advertising, the companies that advertise Tylenol, McNeil, and other companies market these drugs as absolutely safe. So it's important to remember that almost any drug that you use isn't perfectly safe, no matter how much people want to make that case. I was absolutely fascinated by Larry's comments about how the Ohio study was funded. It obviously was wonderful that that opportunity came to the fore, and Lois's part in that. And then my final comment I want to make is I was reading in the brochure, I have two comments. I was reading in the brochure, or the program, about a comment about baby aspirin on the shelves of drugstores. I think it was identified that they were in Hong Kong or somewhere. Well, I am actually quite close friends with the CEO, and periodically I look at things to see what they're marketing so I can actually make my comments at him. My wife also finds that she can get certain foods because he'll bring them in for her. So one day I was in the pharmacy department, and lo and behold, was marketing baby aspirin. This was in the last 2 years. And so I promptly called Dave up and I said, Dave, you know, you've got something on your shelves you need to get rid of. And he was flabbergasted. And I think it's important for us to continue to observe and be surveillant because, you know, we do use low-dose aspirin for cardiovascular disease, but it shouldn't be marketed as baby aspirin. There's no. So that's my educational point for the day. Finally, I will say that I've enjoyed being the medical director for the Reye Syndrome Foundation. I will say that as part of my role, I get queries about cases of Reye syndrome from people who submit to the National Reye Syndrome Foundation. And I will say, in general, most of the cases that are thought to be Reye syndrome probably are not. They probably are something else, and quite frankly, many times I can't define what they are. I can tell you the last case of Reye syndrome I thought I saw, was in 1986. And it turned out to be a boy who was a 10-year-old boy who presented with the urea cycle defect, ornithine transcarbamylase deficiency, which is an X-linked trait in males that typically presents with disease in infancy. But I then was pointed out by one of my colleagues, Mendel Tuckman described this 2 years before in the pediatric research. So I said, oh, stupid me. But the long and the short of it is, many of the conditions we now see, and in the last time I was on call, which was about 4 weeks ago, I saw a new patient with hemizygous OTC deficiency, a female, that had presented with vomiting and transaminase elevation that had ornithine transcarbamylase, easy for me to say, an OTC deficiency that is a mimicker of Reye syndrome. So overall, I think that we've been very effective. This organization has, and it's been a public health triumph that we've actually reduced the frequency, and I share the comments about the grief that these families have and the loss that they have, and I did not realize, and I learned this today, that there is no word that's in the English language for the loss of a child, because nobody ever really truly gets over that. Thank you very much.